Okay, good afternoon, everybody. Thank you for giving me the opportunity to talk today. And I'll try and get through this fairly quickly. I'm probably the dinosaur in the room. And I find it links in with a lot of things that came up earlier in the day, believe it or not. So, air pollution being topical. We've a room of people here today who are all interested in air quality, air pollution, health effects, and so on. But what struck me was that there's an awful lot of stuff in the public domain about air quality in news articles. So, the first one here, US. Here, another one about BBC, 4th of October, fireworks, Indian festival, and so on. So air quality is in there in the public domain a lot more than I expected. I wasn't even looking for it, and it was jumping out at me. So that's good. That's maybe half of our battle linking in with the public. Okay. Historical evidence. There's a book called The Big Smoke by Brimblecombe. His name is missing off this, my apologies. Very easy read. Talks about historical air pollution. And I'd highly recommend it. And here's a reference from the Royal Society, published in 2020, talking about historical records of reference to air pollution and health effects. And Brimblecombe was involved in this publication. And I draw your attention here to two lines. I can't read the small one here, it's an age thing, so I'll have to look at that one. But the very first mention of adverse health effects from air pollution was 400 BC, 2,500 years ago, by Hippocrates, who is known as the father of modern medicine. So we're talking 2,500 years ago. And then there's loads of references right through the ages. I bring you to the one here at the bottom I've circled, from 1864, I think it is, the Great Horse Manure Crisis of London and New York. So thankfully we don't have to deal with that, unless maybe you're in Killarney. And then I jump on here to this 1993 and the 6 cities study in America, which I'll come back to. Now there's a whole load more, but I've just highlighted those ones. So air pollution and health, right? Well, some of you might be familiar with the Monet paintings from London. The London smog 1952. And on the left there you have the London smog in 1952. And on the left-hand side, the green dots represent deaths. And they started at about 250 deaths a day, but they went up to over 900. And even at the end of that period, the deaths are still up at about nearly 450 a day. Recent analysis suggests that continued on for weeks afterwards. So there's probably about 12,000 people died in that incident. But then we move on 30 years, and in Dublin in 1982, we got this huge spike in deaths from people who were being hospitalised, a doubling from Luke Clancy. And Dublin in 1982 on the left, that's what it was like with severe smog. On the right-hand side, later on in the 1980s in Dublin, and you can see smoke coming out from all the chimneys. So that's what we were like in the 1980s. We've moved on from there. And we had a ban on smoking coal in Dublin in 1990. And there's the pollution levels on the left, pre and post. And the left is pre and post, right. I'll skip that one. When we published on this one, we saw that obviously there was a 70% reduction in particulate levels, 30-something% drop in SO2. We saw this huge health benefit. Less people were dying. And less people were dying, less people were getting sick. That's the type of thing we've been trying to get across all day today. So for me, what's the most compelling evidence in relation to air pollution and health? Well, the Harvard 6 Cities study looked at populations in 6 cities in America. And they followed these population over time, so they're cohort studies. And after 16 years, well, after 14 years, if you go up, you'll see the top 2 dots, and you have about just under 90% of the people alive. Whereas you look at the black ones, and they're down below 80%. So you've got about 10-15% difference in life expectancy, or about 2 years. But all of these towns at the time were compliant with the US EPA guidelines. So the researchers who published this, Arden Pope and Doug Dockery, it caused chaos because the US EPA were required by law to take into account any new publications when reviewing their legislation. It ended up that they were hauled before congressional committees, they were up at Capitol Hill, they were castigated, there was a whole load of stuff in the press about them. They were eventually handed over their data for reanalysis by an independent team. The reanalysis said their actual initial analysis was probably conservative. So here it shows if you were living in an area where air pollution was worse than somewhere else, your life expectancy was reduced. Very, very compelling to me. So then we move on, Utah Valley, and it was a steel mill. And they get temperature inversions and so on. But what happened was the mill guys went on strike for 13 months. It's a kind of an unusual timeline. And on the right-hand side here, you have children's hospital admissions for respiratory disease. Now, hospital admissions of kids, you don't admit kids to hospital unless they're really sick. You try and patch them up and send them home. So kids were getting admitted to hospital. Then in the middle, the mill was on strike. And then when the strike was over, it went back to where it had started. So if that's not compelling evidence to reduce pollution, to me, nothing else is, right? Then here's another study, a more recent one from 2024, where they had 59 million people they followed using Medicare records in America. And again, showed that your exposure to PM 2.5 was linked to getting sicker and being hospitalized and so on. So you've huge compelling evidence. So in summary, both episodes of high pollution and low pollution, long-term pollution, are linked with harmful health effects. Exposure causes premature deaths from cardiovascular disease, cancers, and respiratory disease. There's no safe level. That's very clear in the research. So when we're talking about WHO guideline values, fine, let's keep the level as low as we can achieve. I think one of the speakers this morning from the EPA, Pat, works in radiation. We talk about keeping your radiation dose as low as reasonably achievable. That's what we should be doing with air quality as well. Don't be saying, oh, we got below 5 or 10, we're fine, we're not. Try and get it as low as we can, bearing in mind there are natural sources. So if we can reduce exposure, we can reduce mortality and morbidity. And then the other evidence is that the smaller particles are the ones which are more harmful. So what do we do next? Pollution is quite mixed and it differs from place to place. So if you set a limit for PM 2.5, the mix of PM 2.5 in Dublin is quite different to it is in Donegal. It's different to what it might be in London. So that might not be the metric we need. Ultimately, it might serve its purpose at the moment. And then yet throw in the complexity, the climate is changing, so we're changing the things we do. We're using different modes of transport, we're using electric vehicles and so on. Now, EPA, right? And I pulled out two reports. The one on the left, I can't read these. The one on the left is one we did with Martin Fitzpatrick and Dublin City Council. And we highlighted that there was areas in Ireland where there was not enough monitoring going on and domestic heating was a problem. That was followed up by the guys from Cork doing the Sapphire project, which confirmed our findings. Some of the recommendations we made have now been followed through, which is really impressive. So if we looked at 2004 EPA report and the number of monitoring stations, there's not that many. We move forward to 2025 and we now have 115 air quality monitoring stations. So we credit where credit's due. People have responded, they've done stuff, we've improved our monitoring network. And the more data, the better, because there was a lot of places we thought were okay and they weren't. The other thing that concerned me was it took us over 30 years to extend the coal ban nationally, but it's happened, so we'll go there, right? Zero emissions isn't quite what it is. I think you all know this anyway. Even if we have an electric bus, there are PM emissions from the tyres, the brakes, and so on. So zero emissions is a misnomer. It's zero tailpipe emissions. Just throwing that out there. So where next? Well, in London, wood burning stoves is the biggest problem in London. And this is a recent publication. And we're seeing that in affluent areas here in Ireland. And I think some speakers alluded to that this morning. Climate change is happening. So transport is not all tailpipe. We've obviously issues with heating, wildfires. So what do we measure? And I'm also throwing in the caution here, don't throw the baby out with the bathwater. In that we were doing things that were good and we kind of stopped doing them. So one of those was black carbon. And we were measuring things like that in the past and we stopped measuring it. And the WHO have recommended, and I saw some speakers this morning mention this, that black carbon seems to have a very high correlation with health effects. So we should try and keep measuring black carbon if we can. Maybe not at every one of those 115 stations, that might not be realistic, but it's a metric that maybe it's telling us stuff that we were missing out on. And I feel privileged I was involved in that report. Learning from the past, we presented something last year where in Ireland, there was research done on ultrafines 40 years ago, 50 years ago, and it got lost because it was pre-internet. People are now doing research on ultrafines and saying, well, the number of particles might be relevant, not just the mass, and these ultrafines might be very relevant from a health perspective. And a lot of that was done, but it's not been picked up on because it was pre-internet. So we just wanted to highlight that research had been done, colleagues weren't getting the recognition, and there are actually guidelines as to what might be clean air, very polluted air, and so on. So going forward, what should we measure? Well, PM10 and PM2.5 are there. I think black carbon needs to come into it. Particle number concentration of ultrafines and the number of them and the sizing. SO2 and NOx and VOCs, PAHs, and ultimately it's leading us to look at source apportionment. We may not be able to do that at every single site. So from the UK, they're now looking at doing source apportionment, trying to fingerprint what's the source of your pollutants. Is it home heating? Is it oil or is it coal? Is it wood burning? Whatever it might be. So in the UK, they've, I think, about 4 or 5 stations that are starting to look at some of these other metrics that I've mentioned. But these are research tools. They're not going to be used in every station at the moment. But we can learn from these. So here we're part of a consortium that's recently got funding under the Peace Plus programme. It's called Peace Air, Partnership for Evidence and Action on Clean Air. Here are the partners, but there's also other associated partners, the Irish Heart Foundation, Asthma Society, the Environmental Health Officers are all associate partners on this as well. I don't have all their logos there, so apologies for that. And there are 4 work packages involved. Number 1 is to look at home heating, solid fuels, and also to develop a solid fuel testing laboratory on the island. So there was a question this morning about stuff coming in from Northern Ireland and so on. Well, we'll be able to test fuels eventually. It'll take a lead in time. We've only just started. But that will give us that capability. We'll also be able to fingerprint the particles with our colleagues from Cork and Galway. We're going to be doing twin town approaches, measuring north and south in twin towns using very sophisticated equipment. Vehicle emissions will also be analysed, and farming emissions. And then rolling into this, then there's cross-cutting, looking at health effects, social determinants, and then feeding into policy and advice back to stakeholders. So it's on a cross-border, cross-community basis with engagement with schools and the public. In TU Dublin, we will have a new mobile lab coming on stream very soon. We got funding for this. It's cost us about 1.1 million, and it has an array of equipment that is going to allow us to do source apportionment, measure particle numbers, identify what the source of pollutants are, and so on. So there's some of the gaps and challenges we have. And then on health data and epidemiology, I just want to mention, there is a disjoint between health data and exposure data. Being able to access appropriate health data is a problem. Being able to access it in a timely manner is a problem as well. There was 2 other things I just wanted to mention which weren't on my slides. In the past, I did some work with the Asthma Society, and I had a friend whose son died from an asthma attack the week before Christmas, a number of years back. So I have great admiration for what they do. Our first speaker this morning, and it reminded me of stuff I'd done and forgotten, in Krakow and in Poland, they have this smog alliance. I'd forgotten, but they asked us to go over and talk to them about the experiences in Ireland with banning coal, because they were having similar issues and they wanted to be able to show, it worked with us, can we get it to work over there? They produced coal, it was a bigger challenge for them, but they took on that evidence, and I'm delighted to see the evidence presented this morning. So thank you very much.